Hello guys, this is Dr. Dheeraj Masapu and today I would like to cover a very important topic. Then some specializations, what is happening is there wouldn't be much money that you see like other specialities, and recognition also is very less. Okay, because according to me, these branches are not waste, but they exist for a different purpose. They exist for different meaning, which I'll tell you in the end of the video, but they are not surely for making money. So that is the very important thing that you need to understand. So what are those specialties then? Why isn't somebody not able to make good amount of money with these specialties? So basically, I'll tell you the some kind of a checklist or criteria to call a specialty, to come and fall into this category. Number one thing would be these specialties wouldn't have OPD facility. For example, you can't make an OPD. Then if you argue that with MBBS anybody can make an OPD, that's a different story. But with these specialties, you can't make an OPD. So patient follow up and patient base wouldn't be there, which is what many hospitals want actually. And second thing is, second important factor is they can't make their own hospital independently. See, the thing is, anybody can make a hospital, even MBA can make a hospital, but the safety comes when you have a patient base. When you have a patient base, what happens is, they come for you. So, minimum guarantee, running costs would come. Okay. So, that is a very important thing when somebody is making a hospital. And then, third important thing is in these specialties, even though you get the job in corporate, the plateau is there, beyond which hospital cannot pay, because it is not possible for hospitals to pay beyond a point. Like, for example, maximum I think some 5 to 6 lakhs is what they can pay. And these specialities are designed to be more focused on academics and to support other departments, or so a general kind of a service. So this is the criteria. The specialties which I'm going to tell you in the video would meet. Okay, so that's about it. And then so next, let me start the specialties. So all the non-clinical, purely academic specialties would top the list. Okay, like anatomy. Even the anatomy can't earn money, but that is the foundation of medicine. And actually, our anatomy professors actually taught us, very nicely, and even we have our best and favorite anatomy professors. So, but income is capped, maybe 1 to 2 lakhs you can earn in a month after becoming a senior. Physiology also would come in this particular category, but they will have a lot of academic and other scope if they join coaching centers like Marrow, Bhatia, and prep ladder and all that. They can join and take NEET classes. Biochemistry and pharmacology also I'll keep in this category, but pharmacology I did a video you'd have seen recently. A lot of pharma side good scope of salaries are there, but if you stick on to medical college side, again there is a ceiling. Pharma side also, if you're smart enough, you'll reach very high salaries, up to crores also you can reach. But if you're sticking on to the medical colleges, is what I'm telling. If you stick on to medical college, then you will fall in the category of no money and recognition category you would fall into. Okay, but still, see, recognition is among the general public, but you will be recognized among your peers, among the other pharmacology people, among your students. That's a different recognition and value that you get actually. And over a period of time, what I feel is once you cross 40s, you will not actually want to be recognized among general public. You want to be recognized among your peers for your good work, and even few students, if they tell that you taught them well and their life changed because of you, that is enough for you. Anyway, that's a different story. Forensic medicine also falls in the same category, and there is no confusion in that. Next, let us come to the other pre-paraclinical specialties. Pathology, microbiology also would fall in the category. With pathology, if you go into business side, if you set up your labs, chains and all that, that's a different story. But if you stick on to medical college and teaching side, you fall into this category. And microbiology, community medicine and all that would fall into this. In community medicine, there is a good opportunity, it seems, to enter WHO, UNICEF and all that. I exactly don't know how much salaries you would get there, but I think you get a good amount of salaries if you go that side. But if you're sticking on to some kind of public health job or epidemiological job where you're making policies and all that, you actually will get a lot of recognition among the policymakers. You will have good contacts with the politicians and all that. So in that way kind of recognition you will get. Okay, so that's about this. And transfusion medicine, nuclear medicine and rehabilitation medicine and these kind of emerging specialties, actually So here they are like support systems for the hospital. So like transfusion medicine person, what do they do? They take out the blood banks and then stem cell units and plasma, centers and all these things. They would take care. So and nuclear medicine also would fall in the same category. Even though they're like very emerging, so they will have a kind. They will meet the criteria. They will have a cap in the salaries. Okay. So but for nuclear medicine salaries are good at present. 3 to 4 lakhs is what they're getting, but transfusion medicine wouldn't get that much. Okay, then coming to anesthesiology, radiation oncology, physical medicine rehabilitation, palliative medicine, and all these specialties also would fall in this category. Even you can keep emergency medicine also in this category. So these specialties are not little better than what I previously told in salaries wise, because they are more into the clinical side, right? So they might earn little more, but still there is a capping, there is no recognition. The amount of money that you earn wouldn't be like surgeon, but you learn in your early part of career in these specialties. That is a very important thing. As if you're my subscriber, if you've been following me since a long time, then you would have seen my videos where I explained if you invest little early in your career, what kind of money you can make. Up to 100 crores also you can make. So that advantage you will get here. But if you purely compare the kind of salaries that you get, would be lesser than what a clinician would get, like a neurologist, or endocrinologist, or gastroenterologist, or some neurosurgeon, or gastrosurgeon, or some oncosurgeon. They would surely get more than you, or neurosurgeon would earn more than you. So that is the point where I'm going to. So that is about the genre which I tried to cover in this particular video. But I'm not done this video to insult or tell that these specialties are inferior. These specialties are built for a different purpose, I feel. So these are good for medical education. You can do a lot of research, and you can actually enjoy by doing fellowships in these specialties, going into niche areas and working. Long-term stability is good. Corporates want you. Nobody is going to question you how much revenue you are making. Nobody is going to question you how many patients you are seeing. Nobody is going to question you whether you've done the marketing and you've done all these things. So what I feel is these specialties are very good in terms of satisfaction and long-term wealth making. So that is about this, and thank you all. So that's specialty, and these are the support pillars. They don't mint money, but they save the systems. They ensure that your system is going well, surgery is safe, and every drug is correctly used. And thank you. And if you want me to do a video on high earning specialties, then subscribe to the channel and comment in the comment section. I will do that also. And thank you very much, guys. Thank you for following the video till the end.